bed is only for sleep and intimacy with your partner.
Anything else kind of confuses your brain.
The sleep bed. I'm not sure whether it is a marketing gimmick or does it really help.
There are people who sleep on the floor.
People say that, okay, so I'm a night shift worker, give me some tips, diet tips. The first tip that I say is that if possible, quit the job.
It is also not practical for me as a sleep physician to write for everyone saying, hey, he or she should not do night shifts. That's not fair.
Please explain about what is delirium and why it happens in ICU.
Somebody may not be used to air condition all through the night, whereas in the ICU, it is air conditioned.
But when you're sleeping on the tummy, now I'm very interested. Is it because of the neck angle or is it something happening in terms of...
Do you know you're in the minority?
Colder the temperature, better the rhythm. Is that true?
You're married, so I'm sure you played the remote game
Yes.
that I've also played. So all of us have different temperatures that we feel is comfortable for us.
Yes. What do you think about this ring?
I'm not snoring, any of those. But my wearable is telling me I'm not getting good.
My mom and dad absolutely hates
The yellow light.
yellow lights.
It is very strange. Which lights came first, whether it is India or anywhere? It was yellow light.
How about afternoon naps?
If you trace the history of sleep, in the good old days when there was no power, so they used to have multiple sleeps during the day.
I want you to treat them with a song.
உறவுகள் தொடர்கதை.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the science, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode.
Hi, this is Dr. Pal Manikam. Welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. In this episode, I am interviewing my professor, Dr. Ramakrishna. That's why I put my scrubs and my white coat on so that I can show that I'm a disciplined student. He is a wonderful critical care physician with his interest in sleep. As you know, I always talk about sleep because sleep is the most important foundation for your gut health, for your any diseases, you name it. Hypertension, fatty liver, cholesterol, everything is tied down to sleep. In this episode, I am teaching you with his expertise in terms of how to sleep, what is good quality sleep, whether you can take an afternoon nap or you a night owl or an early morning person, which is better. How do you change the surroundings to make sure that you sleep better? How do you identify whether you are sleeping well or not? We covered a lot. I'm sure you will learn a lot during this conversation as well. Please write down in the comment section after the podcast series so that you will understand and absorb the information and not just keep on watching the video and going on to the next video. I really want you to grab some information from this podcast. Let's dive deep into it. Hello, sir. Thank you so much for being in the podcast.
My pleasure.
Sir, I'm very, very excited because you are my professor. That's why I wear a white coat.
Oh, nice.
To show that a student is doing a good job in front of a professor is a very, very difficult task.
No, you have excelled most professors, so I'm sure it's going to be fun talking to you.
So, we are excited for this podcast because I emphasize sleep a lot more in my channel, and sleep is one of the best determinant of gut health based on the research and clinical studies that we do. Right off the bat, I'm going to ask you, is there a normal sleeping duration? Is it, everybody says minimum 7 hours a night. Is that the right thing to do?
Okay. I think with anything in medicine, we don't say single numbers, right? If I ask you what's the normal blood pressure, what's the normal blood sugar, everything is a range. So similarly here, number one, the requirement of sleep is different with the age. A newborn child is going to sleep about 18 to 20 hours. Whereas as the child grows and starts going to school, it predominantly starts sleeping at the night about anywhere from 9 to 10 hours. And if given an opportunity, may also sleep in the afternoon at that stage. And as the child grows further, but somewhere when they get into the adolescent age group, they actually require about 8 to 9 hours. But unfortunately, I don't think most adolescents get it. Adults require on an average about 6 to 8 hours. So, you're familiar with the normal distribution curve. So everything, falls within the 2 standard deviations, which is about 6 to 8 hours. But there are some people who require less and are perfectly fine with it. There are some people who require more and absolutely need it.
So some patients have told me, so you keep on saying 7 hours, but I've slept in my life only for 4 hours a night, but I feel perfectly fine. Is that something that we can say that, you look perfectly fine, but the parameters might not be the same, or is it okay?
So, we first have to determine whether he or she is a true outlier, because we always say that the impact of sleep more than the night is during the daytime. So if somebody doesn't get good quantity of sleep or good quality of sleep, or is not timing their sleep appropriately, then they feel tired, sleepy, irritable. There are so many things that come with it during the daytime. So I always say that a good night is essential for a good day. So if the day is fine, then we may sometimes say, hey, you seem to be one of those outliers who is sleeping less. As long as you are active, alert, functional the next day, we may have to start accepting it. So don't look at your neighbor and say they are sleeping 8 hours, so I need to sleep 4. I need to sleep the same number of hours. So it can be variable.
How do we know that the quality of sleep is good? Like for me, example, I sometimes yawn a lot in the morning. Is that an indication that my quality of sleep is not good?
Yeah, yawning is a sign of fatigue, and that your brain is not fully rested and all that. So definitely, the way we can recognize that we have got a good quality sleep is, number one, during the night, not having multiple wake-ups, as long as you're resting comfortably and continuously. That, I think, is number one. In the morning when you wake up, everybody has what we call a sleep inertia. Like when they wake up, they may feel a little groggy. It might take some time to get back to their usual level of functionality. But after that, if you're able to function well, if you're alert, active, you're able to concentrate, you're able to do your duties well, then that's fine. The yawning, as I said, is, occasionally a sign that you haven't probably got a full proper
sleep
rest. But that needs to be evaluated if it is a regular phenomenon. Yeah.
How about afternoon naps? Is that an indication?
Afternoon naps, if it is not interfering with your nighttime sleep, is absolutely fine. Because why? Our body has the highest propensity to sleep during the night. The second highest propensity is right after lunch, somewhere around 1 to 2 or 2:30 p.m. At that time, our body has a tendency to want to nap. But it has to be a nap. By nap, I mean, they say it can be anywhere from 10 to 30 minutes, but the magic number is 20. Okay, so somewhere around 20 minutes, if you can sleep, then you wake up feeling a lot more refreshed. People call it a siesta culture. In fact, it's called a power nap. Where you can just wake up feeling a lot more refreshed, have the energy to do more things. So it is perfectly fine if your work schedule allows it, and if you feel that it is not affecting your nighttime sleep in any way. Prolonged sleep during the afternoons can affect the nighttime sleep.
So I have seen my mom sleeps in the afternoon for like an hour, but she also sleeps very well at night as well. So that's a normal rhythm for her.
Yeah, see, if you, like anything else, if you trace the history of sleep, in the good old days when there was no power, people had what they called either biphasic sleep or polyphasic sleep. So they used to have multiple sleeps during the daytime, and overall it used to be somewhere in the range of like 8 to 9 hours is what they had. So it can be biphasic where you sleep twice, polyphasic where you can sleep multiple times. During the Industrial Revolution, they say that it became more like biphasic. They'll start sleeping twice. And with the modern world, with all that we are going through, it's a pure lifestyle change. We have all moved towards monophasic sleep, which is we are trying to get one long sleep during the night time. Now, most people after retirement have a tendency to have a longish nap, if I may say so, sleep for about 60 to 90 minutes or more. Now, the big difference is based on the sleep cycles, if they sleep longer, then they're likely to sleep much deeper as well. If they go to a 90-minute sleep in the daytime, they may get into REM sleep, they may get into real deep sleep, which can cause a little bit of what I described earlier as the sleep inertia. When you wake up, it may not be like a true power nap.
Correct.
You may wake up with a little grogginess and all of that when you sleep a little longer. But I do want to repeat that if your schedule allows, and as you said, your mother could do it twice, and it didn't impair her nighttime sleep, it's perfectly okay.
Let's say a young guy, he's working in software engineer, even a medical profession, who doesn't have a good night sleep schedule. And, you're being interrupted, late night shifts, night shift workers. In your young 20 to 30 years of age, I feel like they are pushing themselves to exert whatever the work is needed.
Yes.
But I think that might be a risk factor for them to develop non-communicable disease down the road.
Absolutely. I mean, you use the word non-communicable diseases, and when we ask people, what are the non-communicable diseases? The first thing they'll say is, obesity, high blood pressure, diabetes, heart disease, cancer, stroke, high cholesterol. Nobody talks about sleep disorders.
Correct.
I think it's a more common non-communicable disorder than all of these that I mentioned, and it probably leads to several of these.
Oh my God.
And leads to uncontrolled non-communicable diseases as well. So to be honest, every opportunity I get, I keep mentioning that the World Health Organization should list this as a non-communicable disease. Sleep disorders need to be listed. Only then I think the awareness would be much, much better.
But I don't think that people are tying down the sleep quality to the development of an ailment. I think I did some basic science research with brain-gut axis on mice in Stanford and San Diego, UCSD, and also in Stanford in California. What we did was, we will run the mice overnight and we'll check the hormone levels in the morning. We will have a deep night's sleep with the mice and then check the hormone levels in the morning. The quality and the quantity is absolutely mind-blowing.
Absolutely. See, I think you are bringing a very important issue. Okay, so our body has several rhythms. One is the, like what we call the diurnal rhythm, like basically like day and night, what is going on. Second is we have an internal clock, which is slightly longer than 24 hours. It's 24.5 hours. So that's what we call the circadian rhythm. And then there are what we call ultradian rhythms, where, internally multiple repetitive rhythms happen. So even during sleep, all these different stages of sleep may happen about 3 or 4 cycles. So that's the ultradian rhythm of sleep. Now, why this is important is, there are certain hormones that are secreted based on day or night, irrespective of your sleep pattern. So that's where shift workers get hugely affected. And same thing with the circadian rhythm. Like there are certain hormones, certain things that change, particularly melatonin, based on, like your sleep, your day, night, all of those would be changing. So it's very important for us to understand that it's not only important to sleep enough, sleep good quality, but sleep at the right time. Okay, so and our body's design is to sleep at night. Now I totally understand what you said. Even as doctors, we've all done night shifts, but there are ways to do it. There are ways to cope with it, rather than like let go of getting good sleep, which has a huge impact. I mean, so many youngsters are coming with cardiac problems. Infertility is increasing, mainly because all the sex hormones are completely messed up when you're doing the,
infertility can be related to night shifts.
Absolutely. And also, like irregular menstrual periods, again, because of female hormones, can be related to shift work. And I think people are getting increasingly cognizant about it, and we need to work on, creating more awareness before it's too late.
I am afraid that it is too late already in fewer populations.
Yes.
In many stages where I go, people say that, okay, so I'm a night shift worker, give me some tips, diet tips. The first tip that I say is that if possible, quit the job. That is the true story, right? Do you agree? But it's not practically possible. But when somebody is in night shift, they should understand that you are going against your normal circadian rhythm. So you are starting the innings with 1 wicket down already.
True. But, there are, as you rightly said, we can't tell everybody to change the job or quit. And, it is also not practical for me as a sleep physician to write for everyone saying, hey, he or she should not do night shifts. That's not fair as well.
Correct.
So I always tell people that understand what is happening to your system. For example, let's say you're doing a fixed night shift. When you go to work, you are eating breakfast, whereas others are eating dinner. So dinner has to be light. They are all eating light. You can have a heavy breakfast. Whatever they are making at home, you can have it heavy. During the night time when you're working, there's a lot of contradictions happening around you. Externally, it's dark. Your body wants to sleep. Whereas there's like bright light right in front of you. You're working on systems which tells you to stay awake and you have to focus. So, lighting the environment appropriately and, making sure that it can work would make a difference. Similarly, during the night time, make sure that whatever you have is light lunch. Okay. Now, unfortunately, because they work night, half the time they only get junk food.
Correct.
That's available. And that's what they tend to eat at night. And then we tell them avoid caffeine about an hour or two after lunch because you're going to go and sleep in a few hours. We always tell people to avoid coffee for about 5 hours. And in the morning when they come back, I tell them that make sure, if possible, carpool. And then, that way you can, cover your eyes with eye shades, prepare your body to sleep because it's very bright outside and you have to prepare your system to sleep. And you go home and the world is eating breakfast, but you're eating dinner. So make sure it's light. And then when you go to bed, make sure that the room is conducive to sleep at night, during the daytime. And more importantly, tell your family not to wake you up for lunch because nobody eats when they are sleeping continuously. And keep your phone away because the world is awake and they're going to try to reach you because they don't know you're sleeping. Okay, with the cell phone usage. So I tell them, practice a lot of these things. It definitely makes a difference.
It makes a difference, yeah. I had a patient, he was 28-year-old. Had a heart attack and was in ICU with cardiogenic shock. 22. Worked in one of these I think Tesla in Bay Area when they were there. And I got consulted because he had severe abdominal pain. So I went there and, he did an endoscopy. His stomach is completely ripped. Okay, it is so red and angry. He's an Indian guy. And, we had a very nice conversation and I said that, why are you doing all this? And he said that, I'm in a very prestigious position. I'm in a senior associate vice director or something like that. And Tesla is like so growing, right? And, I like to be there. I love to be there. And I'm growing in my career. So I said one thing to him is that this is the exact same mistake that I did. That in my medical career, I kept on studying and then finally ended up in a very nice position in my career. But I abused my body so much that I started having problems when I was 33, 34. Yeah. You were 28. So the problem happened 8 years ago or 9 years ago when you were started. So I want you to think through that your sleeping habits is the precipitating factor for this heart attack.
Absolutely. Absolutely. So in fact, that's how I got interested in sleep medicine. I'm basically a critical care physician. So in the ICU, I found number one, that there are so many people who come with, let's say, young strokes, young heart attacks, who've had sleep disorders, like whether it is insomnia or whether it is sleep apnea, any of those undetected, totally nobody. There are so many people who come young with a heart attack. They would have already been seeing somebody for blood pressure, somebody for diabetes. They would have even felt sleepy, had accidents and have been seen by ER and ortho, several people, but never the sleep issue was addressed. That is how I got interested in sleep medicine, being a critical care physician.
Wow.
And more importantly, I also noticed that while in the ICU, patients don't sleep well just because of the environment.
Correct.
And the families don't sleep because they are anxious. So there's a lot of, sleep-related things that are going on, either for the patients or for those, family and near and dear. So that's how I got interested in sleep medicine and pursued it.
I wish, as you said, the more awareness about sleep, if somebody takes it very seriously,
yes.
I think this podcast, whoever is listening to it, should clearly understand that if you don't have good sleep, all these diseases are just waiting to come.
Absolutely.
So focus on the quality of sleep. Let's just summarize that. So now we know that we need quality sleep. And we know that circadian rhythm is a rhythm that is natural to the body. So in our research, what we did, sir, is we made the eye open of the mice and then had the ray of sunlight go through the eyes.
Okay.
And we analyze what is happening in the suprachiasmatic nucleus in the brain and then see what kind of activity is there. So then we did two kinds of research. One is eyes wide open, and the other one is completely shut.
Sure.
And we made the mice both ways, during the day and also during at night. During the day, when it is bright out there, when the mice was completely blocked, the hormones were acting as if it was night.
Night, yes.
Isn't it amazing?
Yeah. So, I mean, this is what they call the Zeitgeber, like basically it's the external stimulus that causes the melatonin secretion, wants you to sleep. So that's why we insist that you need sunlight in the morning, you need darkness in the night. And that's what really helps to keep the, vitamin D levels up in the daytime and melatonin levels up in the nighttime. And that really makes a huge difference. Light plays a tremendously important factor in good sleep.
Good sleep, yeah. Coming to the light factor, our ancestors didn't have light. So they created fire.
Yes.
My mentor, Sachin Panda, he's a circadian rhythm research specialist in San Diego. He always says that human beings are the only species who can make use of a controlled use of fire. All the other species, they can make fire, but they'll not be able to control it.
Yeah.
The controlled use of fire happened because they wanted to do a chat after hunting between the people about the politics, about gossips, and that's how fireside chat came across. But the problem here now in the modern environment is there is no limited availability of fire. It is fire all the time. At night, in the evening. I asked him, so what do you do in this modern environment? So he said that even, for example, this bright light. This is a stimulating factor for your eyes. And that is creating an artificial environment that you are widely active. So what do you recommend your patients of? How do you decrease the usage of lights?
So what we normally recommend is, of course, early dinner, In our country, in India, we say no later than 8 o'clock, but in the US and a lot of the Western culture, we eat by 7 o'clock.
Yes.
So definitely, like eating early and giving at least about 2 to 3 hours before bedtime after that would certainly make a difference. And just as a cutoff time, I always say right after dinner, start using dim lights. So that you are beginning to, expose your body to less light and preparing to sleep. Okay. The next most important thing is all these light emitting gadgets, whether it is TV, whether it is, using your laptops or
computers.
using any of the tablets, computers, any of those emit blue lights. So, I mean, there are a lot of blue light filters and all that are coming. But we say that in general, it's better to avoid any of those at least 1 hour before bedtime. And then do something to unwind. And when I say unwind, it doesn't have to always be meditation. It can be anything. It can be even playing with your children. If that unwinds you, music, reading a book. But when you do any of these, particularly reading a book or any of those, we strongly discourage from doing it while in bed. Just say that, your mind has to connect. Saying that the bed is only for sleep or intimacy with your partner, nothing else. And if at all you are reading a book or anything, better to use backlights rather than lights that are directly hitting your eyes. Any of these stimulates the rods and cones, and exactly the melatonin secretion can get affected.
I come to India very often, and I also go to US as well. When we go to the US, usually, as you know, you're also having a hybrid lifestyle. The yellow lights is very common.
Yes.
In India, my mom and dad absolutely hates
the yellow lights. It is very strange. Which lights came first, whether it is India or anywhere? It was yellow lights.
It was yellow light.
Correct. But then, the white lights started coming only later on. I mean, you remember tube lights were a big phenomenon a few years back, few decades back. So definitely things have changed. But now I think, increasingly people are moving back to
yellow lights. Or the other way we can say, sir, is during the day, you can use white lights.
Yes.
And during the night, you can use yellow lights.
Use yellow lights and preferably not directly stimulating your eyes. That's very important.
looking at something.
Yes. Yeah.
And the distance also matters.
Absolutely. Yeah.
The more closer it is, the brighter the intensity.
Correct. And let's face the reality. I mean, the sizes of the homes in India and all that may not even give you too much of a distance for watching television. So, you need to be cautious when you're doing that.
What do you do at your home? Yellow light or white light?
No, we have both. Obviously, every room has both kind of. Yes. So we've had a mix. Only because, as you said, sometimes when I'm working, I prefer a bright light during the daytime. So I might use it. But in the evening, it's absolutely dim yellow lights.
Me as well.
And my wife has been. She's an interior designer and she wants only yellow lights. So it kind of scientifically I have to agree with her.
I'll make sure my wife doesn't see your wife. Because in the Chennai house, same thing. 2 yellow lights and 2 white lights.
Yes.
We do that. And in the US, the bulb itself changes in color.
Yes.
Right?
So, I mean, those kind of lights are beginning to come in. Intensive care units now can have, light intensity changing during the daytime because a lot of ICU beds don't have windows. So you can change the light to be like sunlight versus. So all those are coming with a lot of fancy lighting.
But that is important, correct?
Yes,
Very
absolutely,
important.
absolutely. So that's why in the ICU, a lot of people can develop what we call ICU delirium or ICU psychosis because they totally lose day-night orientation.
This is a very important point. So, please explain about what is delirium and why it happens in ICU. This is a very important part for the audience.
So delirium, I think the easiest way that most people can relate to is anybody even having a fever, at home, sometimes may say bizarre things or they may not remember what they are saying. They may be confused. Sometimes they may not recognize what's going on. And this may be very brief. Now, when you move patients to a different environment like an ICU. See, intensive care units, there's a lot going on there. We are really caring for very sick, critically ill patients. So there's a lot of noise. There's a lot of lights because of the monitors and everything else that's going on. Alarms keep going on, so the noise can be disturbing to sleep. Plus, you are in an environment where your family sees you very occasionally. So you are seeing strangers, whether it's doctors, nurses, physiotherapists, anybody. So with all this happening, many people can become delirious. So they become confused, particularly common in the elderly. And or those who previously have sleep disturbances or psychological disturbances, mental health illnesses. If they have it, then the chances of delirium is much, much more. In fact, some of the delirium people think may be due to medications that are used as well, but it may be required and we'll have to be cautious on that. Now, when we deal with delirium, we always tell all our trainees and whoever is getting educated, the way to treat that is not by giving more medications. It's not by, doing what we call restraints or, trying to avoid the confusion. It's more to take some time to reorient them, but more importantly, giving them the kind of environment the best possible. You can't change everything in the ICU to see that it is more conducive for sleep. In fact, a lot of ICUs, including ours, have a quiet time in the afternoon where, the alarms may be lower in the volume. And of course, the nurses are there monitoring it and that wouldn't cause any compromise on the patient's safety. We have to be careful about that as well. And, lighting appropriately. And in the night time, see, even little things like the temperature. Somebody may not be used to air condition all through the night, whereas in the ICU, it is air conditioned. So all of those may cause confusion, and it's very, very important to address it, allow family members to be with them so that they can reorient and help.
The most important factor that I want to discuss comparing ICU delirium is the environment that is needed for sleep.
Yes.
So one is it should be a clear-cut evidence that, so daylight is getting transition into night.
Yeah.
So black curtains, black shades if you want to, and dim light, we talked about it. So if somebody is hearing this podcast, maybe they will change to yellow lights at night, or maybe they'll buy a low lux white light, and then maybe they will make sure the black curtains are very dark, that the light is not being entered. I have a question on the temperature. The research that I read was colder the temperature, better the rhythm. Is that true?
So our body temperature dips in the night. The core body temperature dips. That's a very important thing for us to sleep well. Okay. Now, the external environmental temperature is something that has to be comfortable. You're married, so I'm sure you've played the remote game that I've also played. So all of us have different temperatures that we feel is comfortable for us. Somebody might find, really like cold temperature is what they like. Another person might share the bed. It may be difficult when two people require exactly different kind of temperature. So I can't say that a particular temperature is good. Whatever is comfortable for that person is what we need to set it.
In general, when they say keep it at 68 degrees or, like 21, I guess. Is that a conducive environment?
Yes, usually, somewhere between 21 to 24.
21, 24,
Centigrade.
Centigrade, yes. Of course, centigrade. 21 centigrade or 68, it's a very common thing in the US.
Fahrenheit.
No. The common thing is that to decrease from 72 to 60.
To 60s.
But in high heat Florida, where the temperature is like 85, 90, and then you bring it down to 68, you will sleep better at night.
Right.
But the next day when you look at the bill, you may be not sleeping well.
See, it's interesting that you bring this up, because when the external temperature is high and you bring it down in summer, people find it a lot more comfortable. The opposite, when it's extremely cold and you're increasing to bring to that temperature, people don't feel comfortable because heating is a lot more difficult to handle for the body than cooling. Because our body temperature is also dropping, and it has to align.
Just a thought on the sleep bed. I'm not sure whether it is a marketing gimmick or does it really help. What is your take on that?
So, I first want to say that comfort is the most important thing. Okay. Now, there are people who sleep on the floor and are extremely comfortable with that, with a pillow. There are people who just put a mattress on the floor or a comforter on the floor and sleep, and they're comfortable with that. There are others who absolutely need a proper cot and a bed mattress that's comfortable for them. What I would like to say is, number one, the comfort of the mattress should be our body position is, most of us sleep supine. By that I mean like with the back on the bed.
Back on the bed. Correct.
Okay, this is how most of us would sleep. For that, the spine aligns with the bed and it has to be firm and comfortable. Okay, and then we use a pillow. Now the pillow again depends on like how you sleep. Like if you're sleeping on your back, yes, you need a comfortable firm pillow that would probably align your spine, align your neck, and help you to sleep better. For people who sleep on the side, similar thing might work. But there are a few people, and I totally discourage this, but I do want to tell, there are people who sleep on the stomach, upside down, like
me.
Okay. Now, when you do that, then your pillow must be almost non-existent because like otherwise you are aligning your neck and your face in a completely different way, and that's not good. Okay. In fact, in children, newborns, I'm sure you remember the movement in US saying back to sleep.
Yes.
And that was because there were a lot of SIDS, sudden infant death syndrome, in children or newborns who were sleeping on the stomach.
On the tummy.
So that is not encouraged even for adults. The recommended position is you either lie on your back, what we call supine position, or lie on your side. People ask which side, right, left. In pregnant women, they say left is better just because the blood flow, the uterus doesn't compress on the major blood vessels and all that. Left or right is okay for most adults.
But when you're sleeping on the tummy, now I'm very interested. Is it because of the neck angle, or is it something happening in terms of
Everything, you're pressing on your chest, you're pressing on your abdomen. So it, like changes your breathing pattern. All of those. So it is not just the alignment of the position. Okay, so you're going to change your position from tonight.
How do I change?
No, see, there are pillows available for positioning. See, the good old treatment was what they called tennis ball therapy. They said slide a tennis ball so that like you won't lie totally on your back. You'll be a little bit on your side, but you won't.
Say it again. Slide a tennis ball.
In your t-shirt, under your t-shirt.
Under your t-shirt.
Yeah, so that when you roll, this is particularly for people who are snoring a lot when they are lying supine. So we tell them slide a ball so that like you will not be totally supine. You will be sliding on the side so that your snoring would come down. It's called positional therapy for snoring. But like when you asked about those who are lying on the stomach, there are wedge pillows that are available where it won't allow you to totally go flat on your stomach. You just have a triangle wedge so that if at all you go, you're on your side and not totally on your stomach. So you can position yourself with some of these too.
Okay, sir. First time I'm going to order a wedge pillow, sir, after the podcast.
But it's in your mind. You will have to change. So
it will change, huh?
Yes.
It's so comfortable that...
Do you know you're in the minority? Yes, it is comfortable, but it's not recommended.
It's a minority, sir?
Yes.
So, okay.
Most people sleep on the back.
On the back
side.
and the side. Okay. So coming to the most important topic of snoring. Sir, in my practice, when I see a patient with gut health, the first thing I ask is, how often do you sleep? Or how is your sleep quality? How many hours do you sleep? And the next thing I ask is about snoring. Okay, how much do you snore? And the reason is most of them are obese.
Yes.
And that's why they have come with some gut issues. And we have also done research and clinical studies have also suggested that obesity impairs the brain-gut axis. And also obesity also increases the neck thickness, which compresses the airway, increasing the risk of something called sleep apnea.
Yes.
Please educate the audience. What is sleep apnea and how snoring is related to this?
Everybody who snores need not have sleep apnea.
Snoring.
So that is the first thing that I want to say, because snoring is a warning symptom of underlying possible sleep apnea.
So let's repeat that again, sir. So everybody who snores may
Need
not have sleep apnea. Everybody who has sleep apnea
will be snoring. Okay. So what happens is when we are sleeping, when we are lying down, as we go into deep sleep, our body muscles are relaxing. When the muscles are relaxing, the muscles around the air passage, what we call airway, those muscles are also collapsing. So imagine the air passage is getting narrowed. If you breathe through a narrow passage, like, and you make a noise, okay. So as the pipe gets narrower and narrower, the noise becomes louder and louder, but the breathing becomes slower and slower because you are not getting enough air to the lungs. Okay. And when the breathing slows, your oxygen level may come down. Now, there may be a stage when the pipe is closing fully and there's no air movement to the lung and you stop breathing. And your brain signals saying you're not breathing now, wake up, and you go, and then you wake up. So most people would say that I am not aware of my snoring, others are telling.
Correct.
Which is invariably the patient. But there are moments when I hear my own breathing and I snoring and I wake up. And others who witness would say, you know what, even when this person is snoring, I'm used to the sound. But when they don't snore, I'm worried because I know they've stopped breathing. And couples develop this method of pushing them so that they move to the side and then the air passage opens. Because when you are lying flat is when the air passage obstruction is the most, particularly when you're getting into deep sleep. So what this does is whether your breathing is slowing or stopping, you may wake up several times in the night, particularly with a dry mouth, because you're mouth breathing at that time and you may wake up with a dry mouth. And then you may have a tendency to use the bathroom several times. You may want to urinate. And then in the morning when you get up, although you have slept 7 hours, 8 hours, whatever it is, you wake up not feeling fresh. Because of the lack of oxygen, your brain and body have not rested and repaired, so you wake up not feeling fresh. So non-refreshing sleep along with snoring is the number one symptom of sleep apnea. Now it gets to the next stage where the lack of oxygen slowly starts affecting your brain in different ways. People feel irritable. They feel like productivity comes down. They feel like whenever they're sitting and doing nothing, they will doze off, like watching TV or reading a book. They may have a tendency to sleep. Several people who are waiting in my clinic maybe found sleeping because they are extremely sleepy during the daytime. It's called daytime fatigue, daytime sleepiness, daytime hypersomnolence is the medical term we use. So any of these can be the thing, to the extent that even when they have to focus, like for example while driving, they may sleep off and have an accident. I have to say this, there are doctors who when doing a procedure may feel sleepy, and it may happen. There are people working in industries while they're operating machines have had accidents because they are feeling sleepy.
Have you seen patients like that?
Yes, several. Very often you read news saying that this truck driver fell asleep and then like there was an accident. Everybody reads it and moves on. I feel that these are the people who need to be evaluated and made sure that they do not have underlying sleep apnea. Okay.
Wow.
Now, in addition to all these psychological issues that I have told you, there have been marital issues because of this, not just because of the snoring, but it gets to a point where they say, oh, he is lazy or she is lazy, not working, not able to perform, lost a job. All of those, there have been divorces relating to this.
So in our community, they say, Nalla korata vittu thungra, which means snoring is related to good sleep.
Snoring is thought to be sound sleep. But it is sound making sleep. It is not sound sleep.
We talked about obesity causing sleep apnea. But there is also another category where lean people having sleep apnea. How does that happen?
I'm glad you asked this because particularly in the Indian population, Asian population, we see a lot of non-obese obstructive sleep apnea. It is thought that it's probably related to our craniofacial structure. By that, what I mean is our facial structure. Sometimes people have a flattish face, and then some people have what we call retrognathia, like their lower mandible might be slightly inner. The lower arrangement of teeth might be slightly inner.
So the lower jaw will be backwards.
And there are some people who have what we call mandibular hypoplasia. By that, again, this part will look underdeveloped. It is not prominent. These are the people who can develop sleep apnea.
Why? Because they can obstruct the airway.
Now, there is also some thought, and there is not enough data to confirm, is if you have central obesity, like particularly middle-aged men can have a little paunch, those kind of things can also probably lead to sleep apnea. So that's why when you come to our clinic, we don't just measure your weight and body mass index, we measure your neck circumference, we measure your waist to hip ratio. Because, if you have a tendency to put more weight there, then the chances of sleep apnea is more. You may look lean, but you're accumulating fat in
skinny
the areas
fat.
that could.
Skinny fat. That's
They call it the lean fat Indian.
The lean.
So that's what it is.
Toffee. Toffee is thin on the outside, fat on the inside.
Yes.
So there are also an increased risk of sleep apnea. Let's say a person is snoring. What does a family member should do? Take the person to the doctor right away, or just take the doctor only when there are gasping episodes, or watch good night movie?
Can you guess what most family members do? You get one chance.
Most families go to the next room.
No, they record a video.
They record a video? Are you serious?
Most of them would record a video and bring it when they come, because the person who snores is not aware.
Correct.
Okay. And others are telling them and they won't believe sometimes. So they'll record and then show them and bring them to the doctor saying that I can't sleep, because, it's called spousal arousal syndrome. Basically, because the spouse snores, they may not be able to sleep at all. Some people use earplugs. Some people go through what's called sleep divorce. Exactly what you said. They may go to another room and sleep. So all of this impacts their intimacy, impacts their lifestyle, all of those. So yes, if somebody is snoring, if it is very loud, or if they have noticed moments when, like it is very loud, stops sometime, it is not. So then it is better to get it checked. I'm not saying everybody will have sleep apnea, but it's better to get it checked.
So what is the
Particularly if they have daytime symptoms, if they are waking up not feeling fresh, if they're feeling tired, if they're feeling sleepy, you've seen them sit and sleep, they've had accidents relating to sleepiness while driving, or if their blood pressure is uncontrolled, diabetes is uncontrolled, all of what I told earlier, but these are things you keep in your mind saying, you know what, this is not just snoring, there's something more, let's check it.
So that spouse should look for daytime sleepiness or fatigue and arousability, irritability and all those things in the partner.
Yes.
So let's say, is there any home remedies that they can do for snoring?
So number one, as you correctly said, obesity leads to snoring. In fact, recent weight gain, even if you're not in the obese category, but you've gained like several kilos in the last few months, then weight loss would certainly help with reducing the snoring. But again, I'm cautiously using the word only snoring and not sleep apnea.
Correct.
Because unless you know
evaluate.
what it is, then there's no point in sleeping on the side. We already talked about position. Sleeping on the back always increases the snoring. So sleeping on the side might help a little bit. Yoga, breathing exercises, particularly what we call pranayama, seems to help the reduce the muscle collapsibility and can help.
You have seen patients.
Oh, yes, yes. So, and if they have other issues, like if they have a dental, lack of alignment, or what I told you as far as the jaw being, so checking with the dentist if any of that needs to be fixed. All these things can help if it is snoring or if it is mild sleep apnea.
It's a very important statement. All snoring patients may not have sleep apnea, but all sleep apnea patients will have snoring.
Yes.
It's a very important point. So, how about that snoring aid?
Breathe right.
Strips, nasal strips.
Yeah. So basically, those are all modifying the anatomy a little bit, and therefore, particularly when you have nose blocks or any of those, it can probably reduce the snoring to some extent, but it won't treat sleep apnea. So that is what people need to be cautious. It's like missing the forest for the tree. So you're too close to it and you may not get treated. So be cautious. If it is if your doctor has confirmed that it's only snoring, you've made sure that there's no other obstruction in your nose or throat and you want to use it, then it's okay to use.
So I want to take this opportunity to raise awareness about sleep apnea test. And I had the exact same thing what you said. Okay, I didn't have snoring, but I had early daytime fatigue and daytime sleepiness.
And you're not obese. So exactly, you're proving more than one point. Yeah.
Correct. I'm not obese. Even when I was big before, I didn't have this problem. But when I lost weight, I started having this issue. And you know the history very well. So I used to be very tired towards the afternoon, 2 p.m. to 4 p.m. And I couldn't even sit. So then what I did was I went to sleep apnea evaluation. Because I'm a medical doctor, I was able to understand the importance of sleep apnea. There are two kinds of testing. Home testing where you could just test it at home, or a sleep lab testing, where I went to a sleep lab. I showed you the reel.
Yes.
And they connected me with all these wires. I was very happy that I did that study because I was diagnosed with mild to moderate sleep apnea. Was that a big problem for me? I was able to understand that the early daytime sleepiness and the fatigue was related to the sleep. That is why I went and checked. What is the awareness among patients right now?
It is a lot better than what it was 20 years back.
Okay, super.
So I want to start on a positive note.
Nice.
But we are probably still seeing the tip of the iceberg. Okay. Anybody, if they have like blood pressure or diabetes or heart disease or a kidney problem, would never hesitate to go and see a specialist.
Yes.
But when it comes to sleep, it is for sleep, why do I have to see a specialist? Sleep has to come naturally. Snoring has to go naturally. Everything has to be natural when it comes to sleep. They forget that sleep problems are as important as all your other chronic health problems. And therefore, yes, the awareness is improving and they come with a lot of questions. And, I think both the print media and the digital media have really helped in creating more awareness.
Nice.
But they've also started creating some panic. So, like we need to be cautious.
Why panic?
Because, now there are a lot of wearables. I see one. Okay. So
Tell me, what do you think about this? Right?
Okay, I'll tell you in general about the wearables. Okay, the wearables it's going to be the future. So I'm not like criticizing them in any way. But when it started, the technology was reasonably good at finding the duration of sleep. Like if you are waking up often, or because it's basically a motion detector.
Correct.
So it's like when you're moving, when you're getting up, then it detects your thing. Now, the other ones that you are wearing also have, they're looking at your blood vessels, and then they're seeing how the pressure is changing, we call tonometry, those kind of things inside your, blood vessels, and indirectly correlated with the depth of your sleep. Now, as of now, most of them, and I'm not going to talk brands, I'm not going to talk anything. In general, most of them are good with detecting the duration of sleep, but not the depth of sleep. So why I said it causes panic is I've had patients who come to me, even yesterday I had one who said, I'm not getting good quality sleep. I'm like, how does it bother you? No, but my wearable is telling me that I'm not getting good quality sleep. I said, are you sleep? Oh, I go to bed at 10, I sleep immediately, I wake up, I'm not snoring, any of those, but my wearable is telling me I'm not getting good. So, those kind of panics do happen for some people.
There is a term for that, right? Chronic orthosomnia. No. The insomnia caused by the panic by the devices.
Yeah. Everything has a name today. I've been fascinated by some names. Have you heard of Nappuccino?
Nappuccino? What is Nappuccino?
So Nappuccino is basically like you have a cup of coffee and then have a 20-minute nap. And then when you wake up, you are a lot more fresh.
Oh my God.
Okay. So, they come up with all these interesting terms. I'm not familiar with the term that you mentioned, but there are so many more.
So that's what you mentioned, right? The panic that what is my quality is going to be on the device itself is a problem for...
Exactly.
So, maybe just to document the sleep duration, you can use it.
Yes. Yes.
But don't go in depth.
Yeah.
Because tracking the sleep time is also important.
Yes, absolutely. When you are sleeping and whether it is continuous, whether it is fragmented. And I must tell you, it is getting increasingly better day by day. I mean, interestingly, we did a sleep study, a level 1, what we call in sleep lab sleep study. And there was a person who insisted on wearing his wearable also to compare. And the apnea hypopnea index, what we calculate number of times their breathing is affected, was exactly matching between the two. So it is definitely beginning to improve. I wouldn't generalize, but I think the future is there. I mean, there's going to be a lot more.
Okay.
Which will make sleep testing easier.
Okay. As a spouse or as a family member, if I see somebody snoring and I'm feeling that the patient may have sleep apnea, I will have to bring it to a sleep doctor.
Yes.
And then the test to diagnose sleep apnea is only through sleep study.
Yes, as of now.
Okay.
Yes.
And the sleep study, as we discussed, can be done into two parts, in two different ways.
Yes.
One is the sleep lab, and the other one is at home. Any preferences?
The one in the sleep lab is what we call level 1 polysomnogram. Basically, what we do is we have EEGs, so we can actually find how they are sleeping. Is it light sleep? Is it deep sleep? Then we also monitor whether they are moving their eyes, because during the rapid eye movement sleep, people move their eyes. So, and then we also look at how is their airflow, how are they breathing, how is their oxygen level, how is their heart rate. So there are a lot of parameters we monitor in a polysomnogram. In a level 3, or what we call home sleep study, or a cardiopulmonary sleep study, different names are used, is where we only monitor the airflow, breathing and the oxygen level, and indirectly the heart rate from the pulse oximeter. So in this, my approach to this is, if I have a high index of suspicion that this patient has sleep apnea and no other major lung comorbidities or heart comorbidities, then I'm perfectly fine with doing a home testing.
Okay.
But I tell my patients that if this comes positive, it helps me. If it comes negative, it does not completely rule out sleep apnea. Why? Because in this study at home, we are not connecting EEG. So let's say you are wearing it but never slept. Then it will come as negative because it is sleep apnea. It happens only during sleep. Or let's say I've connected it at 10 p.m. and you start sleeping at 5 a.m. and our technicians have removed it at 7 a.m. Only 2 hours of sleep recording, but then it would average it to the 8 or 10 hours. So it will be falsely low. So we have to be cognizant of this. This is why I feel like the sleep study, wherever you do it, has to be read and reported by a specialist.
Usage of melatonin. Any recommendations?
See, it's unfortunate that, like the regulations on medications is, I would say, interesting. Even in a country like US, where, medications are very heavily regulated and what is available over the counter is, very minimal. But people learn to, cheat the system, if I may say so, for lack of better term.
Correct.
Because, I'll take your own example. A prescription of a proton pump inhibitor like omeprazole or pantoprazole, 20 milligrams is prescription, 10 milligrams is over the counter.
Correct.
Okay, so why not I take 2? So that is the attitude people develop.
Correct.
Now the commonest medication that was used for sleep earlier on was Benadryl. Okay, it's a branded name, but I'm just telling you it is an antihistamine that is used.
Diphenhydramine.
Right, diphenhydramine. Now, the antihistamine is used for allergies. It is used for cough, cold, whatever, but not for sleep. Sleep is a side effect. Okay, but people start using it over the counter for sleep. Okay, so the same thing is happening now with melatonin. Okay, melatonin is being studied mostly for rhythm disturbances. Like you can use it for short term, jet lag and stuff. There are some studies showing that it's useful in some other sleep disorders. I don't want to go into crazy details like REM behavioral disorder. There are some places where we can use it. Yeah. But to use it as a gummy or, say that I can want to pop it every night for sleep is not something that's recommended. Because any medication like this will have a tendency for a tolerance. People just popping it in as and when they like is not something that we should encourage. Unfortunately, in several countries, it is over the counter.
Yeah.
Interestingly, in India, it is a prescription drug. While
I was mind blown by that.
Yeah.
Antibiotic augmentin is not prescription. You can buy over the counter.
But you yes.
Melatonin.
Anything to do with sleep, I think the regulations are becoming better.
But that's good.
Yes, it is good.
That's good.
Yeah.
That's good. Another important piece of information is melatonin in the US dosage is 1 milligram.
Yes.
Here it is 3 milligrams.
Yeah.
The starting dose.
Right. So melatonin pediatric there is 1 milligram.
I see.
But you get 5 milligrams, you get 10 milligrams.
I see.
So here we get only 3 milligrams as of now, but there are some, products that are beginning to come out that are 5 and 10 milligrams. But based on studies, my personal belief is that if 1 milligram doesn't work, 100 milligrams will not work with melatonin. So there's no point in people popping more and more.
I see.
Unless you have a medical supervision on reason why it is being done. I mean, there are very specific conditions where I've used higher doses.
I see.
But not always.
You travel as well. I also travel to US. Especially California is like exactly 12 hours back, right? So any role of melatonin at that time for short term?
Yes. So whenever we travel from east to west,
from east to west.
The sleep disturbance would be less. Why? Because I'll give you an example. You take a flight from New York and you're going to Los Angeles or San Francisco. You are landing at a time that is only a few hours away from New York.
Correct.
Because of the 3-hour difference. And you now have to stay awake.
Yes.
So your body can stay awake at any time. You can push it. But imagine the reverse. You take a morning or afternoon flight from California and you land in New York. It's already, let's say, 10 p.m.
Correct.
Or you have to go to sleep. But your brain is telling you, oh no, it's only 6 or 7 p.m.
Yes.
I'm not yet ready to sleep.
Yes.
So it's always easier on jet lag when you travel from east to west rather than from west to east. Same thing you will notice between India and US.
Correct.
When you land there, your chances of coping is much, much better.
Correct.
Whereas here, you always land at midnight or later,
Yes.
and you have to go to sleep and you can't sometimes. So melatonin does help. I do take it during travel, but with aging, you have to understand that the jet lag lasts longer. I always tell everyone that once you hit your 50s, it can approximately take 1 hour a day for the adjustment. So if you're on a 12-hour time difference, it might take you 10 to 12 days for you to totally reset.
Yes. Even for 3-hour difference, it may take 3 days for completely reset.
It can.
Because the internal clock is the determinant.
Yes.
External, you are changing. That is just absolutely mind-blowing.
Yes.
It is so interesting, sir. So interesting. And also kids, they adapt very well.
When I was in my 30s, I've gone to the US for 1 day and returned. And I was perfectly fine. Today, I can't do that.
Yes.
So it does happen,
Even though you look like 30.
Thank you.
So thank you so much. So wonderful. I wish we keep on talking about this. I'll bring you back again.
Absolutely.
And people, I want to let you know, this is not a paid podcast or sponsor or anything. He's doing such a wonderful job. Please check out Nitra Clinic in Chennai. You do sleep studies, in-house, home, doesn't matter. I strongly feel that maybe after this podcast, if you figure out any kind of sleep disorders in your family members or anybody, please take immediate step to refer to a sleep therapist, because that itself is a dedicated expertise.
Absolutely.
These days. And I know you are great in critical care, great in sleep, and also you're great in singing.
I don't know about part 3 of the story.
Okay, so this is an interesting segment for us where we're going to show your talent. Okay, so I'm going to give you a situation. Situation is, we talked about sleep divorce, where a couple is concerned about the person's snoring. They are in front of you. I want you to treat them with a song. Or explain the condition about this with a song.
No, you mentioned about my Carnatic music singing, but I feel music is a therapy by itself. And, soothing songs help you to sleep. Lullabies in the olden days have always helped people sleep. Snoring can cause a lot of relationship issues. And we also have to understand that each one is different. Okay. So I'm going to, although it may not be 100% match, I'm going to sing a song from a movie called Aval Appadithan. By that it means like she is like that.
She's like
So each person is different. So we need to,
nice, sir.
and it's a song about relationship and very melodious song. I'll just do a little bit of it.
Please, sir, please.
உறவுகள் தொடர்கதை உணர்வுகள் சிறுகதை ஒரு கதை இன்று முடியலாம் முடிவிலும் ஒன்று தொடரலாம் இனி எல்லாம் சுகமே.
Super, sir. Do you sing this to your wife, sir, every night?
She sings better than
She
me.
sings better.
Yeah. She is also trained and she
Is it
loves
right?
film songs.
Nice, sir. Super, sir. So I think there are lots of things to be discussed, even more in sleep thing. I just wanted to introduce, this is the first sleep podcast that I'm doing. We will talk more again in one of the next podcasts. So thank you so much for your time,
Thank
sir.
you so much. And, it really helps to create awareness. I still feel it's a ignored problem and very few people are seeking diagnosis and treatment. We can all be healthier if the world sleeps better. It is not just an individual's problem, it's a public health problem. I really think it needs to be addressed. Thank you.
Thank you, sir.